All right. Hello, everybody. Hello, and welcome. So excited to have you here with me today. I am going to try to go live on Instagram as well. Give me a second here. All right. I think we did it, Mark. It looks to me like we are live on IG as well. Woohoo. All right, guys. Oh, never a dull moment with tech. That's all I can say. So hello, everybody, and welcome. Welcome to Live with Lesli. And I'm Lesli Bytel, and really happy that you're here with me today. So for today's live, I think you guys are going to love this topic. Seriously, it is by far one of the most requested topics ever. Okay, so I think you guys are going to love the topic. So here's the situation. If you find yourself, especially if you're an RDN, and you find yourself continually perplexed, shall we say, about licensure and licensure laws, and really how this impacts your ability to navigate telehealth and cross state lines and all that good stuff, you are going to love today's show. So today we're going to get another perspective on this important topic, and really looking forward to chatting with Mark Rifkin. And Mark worked for the Academy's DC Policy Office on licensure and related issues, including state legislations addressing unqualified providers and the upcoming licensure compact. And I got to say, I'm really excited to learn more about that myself. So we're going to talk about licensure, and we're going to get Mark's perspective, him having lots and lots of many years of experience working in this particular area. He is going to share his viewpoint. And I do want to preface this, as always, I myself am not an attorney. So it's always a good idea if you want to dig deeper and really, make sure that everything you're doing is up to par in terms of licensure laws. Never a bad idea. In fact, a good idea to consult with your own attorney for just to learn more about your own state licensure requirements and limitations. All right. So with that being said, let's go ahead and jump in. Really excited to introduce Mark Rifkin to you all today. So welcome, Mark. We finally made this happen. We've been trying to arrange this, and a lot of scheduling challenges got in our way, but here we are today. So welcome, Mark. How are you?
I'm good, Lesli. It's been a pleasure to be here with you, and I commend you on your new degree in technology.
Thank you. Yeah, tech is an ongoing, we'll just frame it as a challenge sometimes, right?
Yep.
But nonetheless, we are working with it. I think it's all cooperating today, which I'm super happy about, because this is such an important topic, and I really want to be able to, share it far and wide. So to kick things off, why don't you share a little bit about your background, and how did you give us a little bit about, your educational background, maybe a little bit about your work history. How did you end up where you are today?
Well, my first degree is in environmental studies, and I spent the first 15 years of my career after college in environmental health, inspecting local water wells and septic systems.
Okay. Huh. Fascinating.
And at the time, I was already a vegetarian, so I decided that if I'm going to advance that as a goal, I need to work with people and help people and make that dietary change effectively. So I went back to school for dietetics, became licensed at age 41. And in my dietetics career, I've worked in private practice as well as a low-income clinic. And and then that was followed by the 6 years in the Academy's DC Policy Office. So this information is based on the work that completed by myself and Pepin Tuma, who's an attorney who was employed there as well.
Great.
So, and also a little bit about my motivation, even though I no longer work in the licensure space. In my opinion, the most significant ROI for the profession lies in primary and secondary prevention, and our collective ability to optimize our impact for the largest audience possible.
Okay. Yeah, from more of a public health perspective, right?
Exactly, more of a public health perspective. So the most impactful settings are going to include private practice and outpatient. And therefore, if we can effectively drive a greater proportion of the profession into those type settings where they can have the biggest return on investment, the profession as a whole becomes more impactful to the public.
I love that. And that is so very important because, gosh, there's so many people in this country that need the help, right? So
Definitely.
I think that is a fine motivation. And I concur with you absolutely there. So, so fantastic. So, all right. So let's jump right into the topic that we have on the table today, because I know we've got lots of people joining us, kind of waiting with bated breath, right? Because let's be honest, this is it's murky, right? It's confusing. It's murky. I have heard so many reports of dietitians calling the academy and just getting like no answers, essentially, or they hang up feeling more confused, right? And the reality is, from what I hear, there's some attorneys that are a little confused too, right? Where they're like, they just kind of put their hands up, right? Now, I do want to clarify that we've had attorneys on the show and they are not confused, right? So just putting that out there. But I have heard of others that do, it's murky. I think that's the best way I can put it. So can you summarize the, kind of the national licensure picture and how that can impact RDNs who do want to move into telehealth?
Thank you. So currently 27 states plus DC license the practice of MNT. And one state just recently passed a new licensure law that will take effect in about a year and a half. That's Michigan.
Okay. Can you repeat that?
So Michigan just passed their licensure law.
Okay. Oh, so wait, Michigan is now a licensure state.
Well,
is that
they passed the law, but it's not yet implemented.
Okay. Wow. Okay. Because Michigan has been non-licensed, well, obviously, forever.
Yes.
Okay. Wow. I would say that is a pretty significant accomplishment.
Yes. Michigan was working very hard on that. And it took several years, several attempts in the legislature to get that to pass. So currently, 18 other states offer an optional license or certification, which may be necessary for reimbursement, but it is not legally required to practice.
Okay.
Now, and this gets a little fuzzy because 3 of those 18 states apparently believe their law actually does require a license. That's interesting.
Okay.
So even though my former colleague, the attorney, and myself concluded that their law did not require a license, New Hampshire, Oklahoma, Washington State, they see it differently.
Yeah.
So of course, the only arbiter of the law in any state is that state agency, and if they say you need a license, I'm going to have to go with the state. But if somebody wants to challenge that law, I think my former colleague, the attorney, and I would agree that the law would probably not be found to include a mandate. But nobody
Mark,
has.
I'm gonna reboot my camera. I can still hear, but clearly I have an issue with focus today. But let's keep on going. Okay, can you tell us a little bit about the attorney that you're working with, or I guess past tense, worked with?
So he was that was Pepin Tuma.
Okay.
So he spent more than 10 years with the academy. working on licensure-related issues and combing through the statutes and the regulations with a fine-tooth comb.
Okay.
And of course, that included also engaging with local affiliates as well as local legislators and local regulators in the agencies to, shall we say, come to an understanding of what the law says, what it doesn't say. And of course, speaking for him in some sense, if I may, a lawyer is going to look for certain language to mean certain things.
Okay.
If that language isn't there, then that meaning cannot be derived, or at least legally defended, say. But nonetheless, certain states write their statutes in a certain other kind of way, and they think that it comes down to a mandate. And when Pepin went to read their law, Pepin would say, well, it doesn't actually say that.
Okay.
Even though the state would swear, yes, we have a mandate. So
what does that mean in layman's terms?
That a license would be required.
Okay.
Practice. So
a license in that particular state to see a patient or
correct.
Work with a client via telehealth in that state.
Well, via telehealth or in person. And as well, I focus mostly here on MNT, not necessarily, say, for primary preventive related purposes.
Okay, for MNT, medical nutrition therapy. Okay,
correct.
Got it.
So that's
high, by the way.
So that's 27 states that have a law requiring a license to practice.
Okay.
18 that, at least according to our interpretation at the time, do not require a license, but they offer it if you would like to get it.
Okay.
And another 4 states that have no law at all.
Okay.
Those are Arizona, California, Colorado, and Virginia.
Okay. So it's the Wild West with 4 states, right?
Exactly.
Okay.
It is very much the
pretty
Wild
much
West.
anyone can hang their shingle. Pretty much.
Yep.
That's what I'm hearing.
Well, and frankly, even in the 27 states that require a license, in most cases, the state dietetics boards don't have the staffing power to check who is advertising services without a license, who is providing services without a license. So most state boards are highly reliant on complaint.
Oh, okay.
If they don't receive any complaints, then it may be the Wild West even in a licensing state.
Got it. And who would be doing the complaining for the most part?
That's a good question. So in my experience, most of the complaints come from either a disgruntled patient, but more likely from an RDN who sees an advertisement or hears about a person seeing, Mrs. Jones, and Mrs. Jones is a holistic nutritionist, and she told me I should not eat gluten for my diabetes or something. And unfortunately, most patients are not going to complain for a multitude of reasons. The largest of which is, even if they know there's a law, they don't know to whom to complain.
Yeah, that would be a little, I think, confusing, to say the least.
So, and finding that specific board, which in most states is going to be, it's going to be a fairly small staff, perhaps 1 or 2 people, buried in a huge administration, and very few people are going to know how to find that staff member. So they're just not gonna complain.
Okay, so patients, disgruntled or otherwise, who see someone who in a licensure state who potentially is not licensed. Is that right?
Yeah. So ultimately, the law is only good as its enforcement. And if enforcement is based on complaint, and few people are complaining, then there's little enforcement.
Yeah.
That opens the door for violators who don't know there's a law themselves or don't care there's a law. So they more or less practice with abandon because there's very little complaint.
Okay.
So,
and what about other practitioners? Do you know, like if an RD sees that, you know, a non-licensed practitioner is doing MNT in one of these, you know, stricter states, is that also a source of complaints?
so in this context, you're referring to as, say, a physician or a nurse or an unlicensed provider.
Yeah.
Well, if they're a physician, in virtually every state authorizes physicians to provide MNT by definition. They are sort of the master of all professional trades, you might say, in some sense.
Okay.
And other professions, of course, claim some scope of practice to provide MNT. I've heard of nurses, I've heard of pharmacists, I've heard of chiropractors. You name it, somebody out there is probably going to say, yes, it's a part of my scope. And, you know, to be honest, again, we're looking at that same complaint basis. So if nobody complains, then the provider may be quite free to continue to practice as they are.
Okay.
Now, I will also add, in many states, nutrition is part of their law. So, for example, chiropractic typically includes nutrition in many states.
Okay.
So, nursing may be more of a challenge, mostly because there's more than 10 times as many nurses in the country as there are dietitians.
Okay. Yeah, there's a lot.
So, as my former colleague Pepin Tumas said, there's more nurses just in the state of Pennsylvania than there are dietitians in the entire country.
Wow. That's a great analogy, comparison.
So challenging the nurses, if they are asserting their right to provide MNT, probably would not be a significant return on investment, you might say.
Gotcha. Okay.
So yes, ultimately, so in some sense, we do have the Wild West in many states, whether they're licensed or not. But at least legally, in 23 states, RDNs not seeking third-party reimbursement can legally provide MNT right now without, bothering the state.
Okay.
Because the law doesn't require a license to practice.
Okay. Interesting. That I think is going to come to be music to many ears here. I guess the next logical question is, what are these states?
Well, if I actually have a map that I can show on screen. So if I present and share screen.
Yes.
And
let's see. As soon as I see that on my end, I'll do what I have to do to share it.
Oops. Okay, do you see a map?
Nope. I do not yet. Let's see. Does anyone see a map? I do not.
Let me go back to share screen here.
Okay.
Oh, that's why, because I selected the wrong image. I thought I had that. All right, let's do that. How about now?
I don't see anything. Do you want to share? Are you able to share that in a comment, and I can share it from my end? Sorry, guys. Well, we're going to figure this out so you can see the map.
Yep. Yeah, I can share it. Can I share it to you after we sign off and
Yeah,
I can distribute
absolutely.
it that way?
Yeah.
Okay.
You could email it to me and I could open it up and share during the live and or after we're finished. Either
Okay.
way.
So so let's see. So and of course, as of right now, you can RDNs can also practice in Michigan because that law has not yet
Okay.
taken effect.
Okay,
But
right.
theoretically, in 2025, that law will be in place. So Michigan will then be a licensing state.
Okay. It'll be, yep. Okay. All right. Yeah, it makes me curious. Were you involved at all in Michigan becoming a licensure state?
They passed their law after I had already left the academy, but I
Okay.
was involved with the Michigan affiliate, working as they made one of their prior attempts in the legislature
Okay.
back in 2021 and 2022.
Okay. Yeah, I just heard there was a lot of pushback.
Yes, and
Why we are just getting licensure there, right? Like a lot of pushback.
Michigan has a rather detailed story, which probably wouldn't be great for all of your listeners to hear, but
Okay.
but there is a lot of, shall we say, political back and forth in Michigan.
Yep. I believe it. I'm originally from Michigan, so I hear what you're saying. All right. So we're gonna, guys, I think what we're gonna do is share that map. We'll share the link. How's that? We'll share the link on the live stream. So you'll just have to go back. We'll share it all over. We'll share it on Instagram. We'll share it wherever you're watching this live. All right, just so you can get your hands on that. So let's keep going though. So all right, so I think this is somewhat rhetorical, but just to make sure everyone is clear, I'll ask it anyway. Can RDs hold multiple state licenses?
Definitely.
Okay.
So, we actually have at least a couple of RDs who hold as many as 10 or more licenses.
Okay.
So,
It's a lot.
yes, that's a lot, and it creates a substantial burden on the RDN in terms of paperwork and administering.
Yeah.
Be sure that
Cost.
that she's up to date everywhere.
Yeah.
But in terms of a practical concept, becoming licensed across a state line is predicated upon understanding that healthcare is defined as occurring in the state where the client is located.
Okay. So
where the provider is located is not all that relevant.
All right. You're kind of going a little in and out in terms of sound. Could you repeat that just so we're really, really clear?
Yes. So healthcare is defined as occurring where the client is located.
Where the client is located. Gotcha.
Not where the provider is located.
Okay. Yep.
So if the RDN is practicing and licensed in Illinois and the client is located in Iowa, then Iowa law governs.
Okay.
Now, of course, the logical path would be for that Illinois dietitian to go get an Iowa license.
Yes.
However, if that Iowa client wants to drive to Illinois, now Illinois law governs because that client is now in Illinois.
Okay.
So ultimately, it's even if that client's location is temporary, wherever the client's feet are, that's the law that governs.
Okay. Wherever the client's feet are. Okay.
Yep.
Got it. All right. So does that make sense to everybody? Guys, send your questions in as we go through. Okay. So we can answer your questions. Okay. So RDs can hold multiple licenses. It can get rather costly. It can also be a bit of a drain from an administrative standpoint, but it's absolutely doable. Okay, so I just want to clarify then, for these, how many states did you say do not require licensure?
23.
23. That's a pretty big number. Dang. That's actually a much bigger number than I thought. And
Yes.
and the map that you're going to share, is that, because some of our listeners today may be familiar with this. It's the color coded map that the Academy used to share on the website, right? I've not seen that floating around very much over the last several years. For a while, it was like, oh, is your state green, or is it, do you live in a green state or a red state? It's color coded green and red. Is that correct?
Yes, it was when Pepin and I created that map.
Okay.
That map has unfortunately been taken down.
Yeah. Can you share why? Why was it taken down?
I cannot speak for why that decision was made.
Okay.
I believe the Academy has another map now, but it's not color coded like the green, gray, red sequencing. But I actually recreated that, and that was what I'll share so that your listeners can access it in color.
Okay. All right. Cool. I'm going to go into my files and see if by chance I can find it myself as well. Okay. So, all right. So the bottom line though is, when we see this map, they're color coded green, right? The states that.
Correct.
Okay. All right. So that'll be really easy to understand.
Yes.
Okay, cool. All right. Let's move into a conversation around what we're calling licensure compact. I'd be curious to know in our audience, has anyone heard of this? Has anyone heard of that, that language? It's kind of an interesting thing to call it, right? Licensure compact. So tell us, what is it?
So compact is basically a legal agreement between states.
Okay.
And this is not a foreign concept in any state because states are already involved in compacts. In most cases, they're involved in many multiple compacts.
Okay.
For example, there's already a compact in every state on driver's licensing.
Oh, yeah. That's that makes sense, right? You don't have to when you drive across country, you don't have to get a driver's license for every state, right?
Exactly.
Okay, great example.
Imagine the headache that would be.
No, God. Yeah, that was rough.
So health professions are already engaging on compacts. I believe the physicians and nurses are already up at approximately 37 to 40 states each.
Okay.
So that means any provider who is already licensed in one of those compact states can theoretically be eligible to practice in any other compact state with not necessarily zero paperwork, but perhaps much less paperwork.
Okay. So what you're saying is states are already doing this in other healthcare professions, including definitely nurses, right?
Correct.
Okay. I didn't know that physicians, like a license to practice medicine, I didn't know that they were doing this as well.
It's actually there's the Council on State Governments which is providing substantial assistance to the Academy as they move the compact forward. The Council on State Governments is a resource on advancing compacts across many professions. And according to them, there's roughly 15 health professions that have already started a compact.
Okay.
So instead of obtaining, say, 10 licenses with 10 different sets of CEU obligations, once licensed in their home state of residence, and that'll become important in a minute, RDNs would then be able to complete a simplified application process, not zero, but a simplified application process and pay a reduced fee to each of their other remote states where they want to practice.
Okay.
So, but those other states are obligated to each pass that a standardized piece of legislation that would be essentially a compact law that essentially says we, the state of X, are joining the compact on dietetics practice.
Okay.
And every state that wants to join has to pass the same law.
What's in it for the state? I'm trying to understand, because, I realize that these licenses generate tons of revenue, right?
Yes.
So, I don't know, I'm just putting myself in their place. What would be in it for them?
That's a very good question.
I'm just wondering, what would be their motivation? Unless they're just getting a lot of, I don't know, pressure from these governing bodies, if you will, to open things up a bit.
Well, they're getting pressure from the professions.
Yeah.
Now that digital health and telehealth are very much a viable proposition, providers want to be able to practice across state lines without going through a lot of paperwork.
Right.
Whether they're a nurse or an RDN. And of course, it's in the interest of the state to authorize. So, for example, it's in the interest, say, of Kansas to join the compact, because then Kansas dietitians can easily practice in, say, Illinois.
Okay.
That enhances the economic potential of dietitians living in Kansas.
For sure.
So it would not be in the interests of the Kansas legislature to say, no, we don't want to join. We think it's bad for Kansas. We're gonna abstain.
Okay.
So in general, most states are probably going to lose a certain amount of revenue, as well as gain a certain amount of revenue.
Okay, so probably hopefully a break-even kind of thing.
Exactly. We believe it's probably, well, when I was on staff, our conclusion was for most interstate relationships, it's going to be more or less a zero-sum game. But there will be some exceptions. So, for example, I'll take Washington, D.C. Most of the dietitians who work in Washington, D.C. don't live in Washington, D.C. They live in Maryland or Virginia, the bordering states.
Right.
So under the current structure, they are paying a licensure fee to D.C. so that they can practice in D.C. in wherever their office is located. If D.C. joins a compact, that licensure fee would now go to Maryland or Virginia.
Okay, right.
So in this scenario, DC would stand to suffer a net loss because many more dietitians coming into DC that don't live there than are exiting DC to go work, say, in Maryland or Virginia.
Okay.
But I believe that's more the exception than the rule.
So here's the big burning question is, where are we with this whole compact deal? I mean, is it a thing yet? Is it happening? Where are we?
It's a thing. So as of today, we have 3 states that have actually passed the compact law.
Okay.
I think I got this right. Alabama, Tennessee, and I believe Missouri.
Okay.
I think. So, but there needs to be a minimum. I believe the minimum is 7 states before the compact is officially in operation.
Okay.
So right now,
anyone that joins it,
any state that joins will then facilitate the practice of their RDN residents to practice in the other 6 compact.
Right, the other states that joined. Got it. Are there going to be like regional compacts, or is it a national thing?
It's going to be a national operation.
Okay.
And The only downside is it leaves out RDNs living in the 4 states that do not have a licensure law:
Okay, right.
Arizona, California, Colorado, Virginia. Oh, actually, in my DC scenario, I was referencing. I said I implied DC was a licensing state. They're not, but
Oh, no licensure in DC?
I'm sorry. There's no license in Virginia.
Oh, got it. Okay, gotcha.
But so that's why. So under the compact structure, each RDN that wants to practice under a compact needs to have a home state that licenses RDNs. And if you live in those 4 states, Arizona, California, Colorado, Virginia, there is no license.
Okay.
Therefore, those probably a substantial number, I would guess probably about 20,000 dietitians, will not be able to join a compact unless they move.
Yeah. Okay.
So
what about if they, all right, so let's say I live in Arizona, hypothetically. Yep. So I wouldn't be able to join the compact. But what if I did get a license, say, in Illinois, and Illinois does join the compact? Does that make me eligible? Do you think?
Good question, but no.
Okay.
Unfortunately, it has to be the state where that is their primary residence.
I see.
So
okay.
They would still be able to be individually licensed in any other state.
Yeah.
Under the current, it would be no different than currently structured.
Okay.
So they would just have to pay those individual fees, fill out each individual application, et cetera, et cetera. But they would not, unfortunately, be eligible under the compact.
Gotcha. Okay. So, I mean, since I've last spoken with you, it sounds like there's progress made, like significant.
Yes. So when I separated from the academy in 2022, there were 0 states that had passed the compact law. So we now have 3, and I'm hoping, say, by this time next year, I'm hoping we'll at least be very close to 7, if not at the minimum of 7, to actually put the compact in operation.
Woo, I don't know. I'm excited. Woo! I don't know who I'm clapping for. Who am I praising? The academy? Who's doing the magic?
Well, ultimately, it's the academy policy office in collaboration with local affiliates and, of course, state legislatures. Ultimately, this is in the benefit of, for the most part, it's in the benefit of the state to allow their residents to practice at the peak of their economic potential. Why would any state want to limit that potential? I can't imagine.
Right.
But and of course, this is ultimately, again, what professions want. It's also what the patients want. Patients want to be able to see somebody. And imagine if you live in, rural Kansas, there may not even be a physician in your county.
I hear you. I mean, I got to tell you, I kind of struggle with that myself. We just moved from Chicago across the border into Lake Geneva, Wisconsin, right? So I still have, doctors in Illinois, and they won't, can't do telehealth because I'm in a different state. It's like, oh, seriously, I could just drive, I don't know, 10 miles and just sit in a coffee shop. How's that? Is that going to really make a difference? Come on, people. Right?
I agree with you. That
silly.
It should make a difference, but in the eyes of, and I've suggested when I was working on staff for the academy, I would literally tell dietitians, tell your client to drive to a coffee shop a mile inside the state.
Exactly.
They are now legally,
it's just what you have to do, right?
But hopefully, as telehealth becomes more of an accepted practice, and the returns and the benefits for health are verifiable and documentable, providers will be a little bit more willing to take that plunge and join the compact, and of course push their state legislature to join if they haven't already. So, and I would add that especially for patients seeking a dietitian, we now have such a diversity in the population of ethnicity, of religion, of food culture, food philosophy, food avoidances, allergies. And as mentioned, I'm a vegetarian. So chances are, a person who is Buddhist and Muslim, from China probably wants to see a dietitian who understands Chinese food culture.
Yeah.
Or a vegetarian wants to see another vegetarian dietitian. They don't want to see an omnivorous dietitian. So this is going to be to the benefit of the patient. And of course, advance the profession in the eyes of the public, that we can, as a profession, meet their needs and hopefully perhaps even exceed their needs and their expectations.
Okay, we got a great question here. What can we do to encourage our state elected officials to put our state into the compact?
Excellent question.
Yes.
So the number one recommendation is to get involved with your affiliate.
Okay.
Even better, see if you have the ability, seek a state policy position on the affiliate board.
Okay.
Most state affiliates have 3 relevant policy positions. They're state policy rep, state regulatory specialist, and consumer protection coordinator. They may have slightly different titles that may vary by state, but they're more or less the same. And of course, if those positions were already occupied, you can contact that person and ask how you can assist. Perhaps that person might train you to succeed them in that role when their term ends. You can, of course, have them guide you to find your state law and the state regulations. Read those documents and understand them, because they are, let's be honest, written by lawyers for lawyers.
Right.
And that's where this all started for me. I became involved in local Maryland policy, it's hard to believe, in 2007. And I had no idea what I was asking, but here I am. So additionally, advocacy with your state legislature is going to be essential.
Okay.
So that, of course, starts with knowing who your state legislative representatives are, participating in your affiliate's advocacy day. Of course, if you live in a state with no licensure law, there is no existing law to research. But every law that gets passed starts with an idea.
Right.
So passage may require several years. We saw that in Michigan. We saw that New Jersey passed their licensure law about 3 years ago. That took multiple attempts as well. So it can be done, given the right circumstances. Although I will say, some states are more likely to consider passage of a licensure law than others. California is probably not going to be high on that list because of the culture of California. But I see no reason why Arizona, Colorado, and Virginia can't pass that law. And in fact, Arizona came very close a couple years ago.
Okay.
So
interesting. So get involved is really the moral to the story.
Yep.
How does one go about finding out who their delegate is?
Good question. Most states will have a website where you can type in an address or some other simple means of identifying your residential location, and it'll automatically kick back your delegate is, your state senator is, you live in district X.
Okay.
So if you can't find that very simply online, again, go back to your state affiliate. I would contact the state policy representative who is the affiliate's representative to the state legislature.
Okay.
They're more or less the liaison to the legislature. So that person, I would think, would have that website bookmarked.
Any other comments that you want to make or points on how expanding these telehealth boundaries, so to speak, can help improve our, really the diversity within our own profession?
Yes. So I think that once students of diverse backgrounds recognize the opportunities
Mm-hmm.
to be their own boss and directly create their own future, they may be more likely to enter the profession and meet the needs of diverse population groups that have gone historically unmet unfortunately, for far too long. I don't have any hard evidence for that, but my impression is what motivates today's adolescent populations is more likely to be driven by desire to make an impact
Mm-hmm.
on that population from which they come.
Oh, yeah, that's a great point.
So, and I look forward to the day when we have substantial numbers of RDNs of diverse ethnic and religious backgrounds who are in private practice meeting needs of the population across the country.
Love that. Great vision. Guys, what are your questions? We're going to wrap up here shortly, but I want to make sure if you guys have questions that we get them answered. And remember, everybody, we will follow up and we'll post the map. I'm going to do a quick search, see if I have that map. I don't know if I do. Let's see. Map. Hang on. Let's see.
And while you're searching, I'll also add, this of course also enhances the image of the profession.
Okay, guess what? I think I have it. Let's see if this is it. Okay, so present. Share screen, I guess, right?
Oh, I just remembered how I messed up.
Okay. Video file. How about whoever can share it first? Let's see. Gosh. Okay, you'd think this would be like really straightforward. Guys, we've got it. We've got it. Just video. Is it a video file? No. Extra camera? No. What the heck? It's not a slide. Okay, share screen. It's not showing. Oh, hang on. All right. Woohoo, I think I got it, guys. Is this it, Mark?
That's it.
Hey, we got it.
Congratulations. So the only change to the map, of course, is Michigan. Okay,
so Michigan is going to turn red.
It's going to turn red. Right now, you might say officially it's still gray, but it will turn red theoretically by late 2025.
Okay, late. Okay, that's interesting. Late 2025. Okay, so we've got 4. Or wait, 1, 2, 3. Yeah, counting Michigan, we have 5 gray states currently, and gray means no license to practice at all. So it's the Wild West.
It's the Wild West.
As Mark stated, licensure did pass in Michigan just recently. So congratulations to everyone in Michigan. That will go into play late, did you say? 2025. So late next year.
Yes.
So, okay. And then the red states, these guys are states that you do need a license to practice.
Correct.
Right? Okay. At least right now, you need a license to practice because this whole compact licensure law, is it a law, a thing? What do you call it? Legislation is is on the table. We're moving forward, but we're not quite there yet. So far, we have 3 states that raised their hand and said, yes, we need 7. So hopefully, as we get closer to, I don't know, when do you think that would happen? By next year? Do you have any kind of?
Yeah, I'm hoping we get to very close to that 7 minimum to put the compact in operation. Hopefully next year. Of course, it's only going to apply in those states that have actually passed it.
Okay.
So, and of course, the Academy policy team needs to work with each individual affiliate and legislature. So there's only a certain number of states that can be logistically managed at any one time in any one given year. So that's probably going to be roughly 3 or 4 states per year. So,
okay, so for the time being, until that whole compact licensure topic gets squared away, what Mark is sharing, and he collaborated with is it the attorney or an attorney with the Academy, right?
The attorney that was on staff at the time in the DC policy office.
Okay. So this is my takeaway. Mark, you tell me if I'm veering off into my own lane here.
Yep.
But my interpretation of what Mark shared is that he and this attorney, who's an expert in licensure, they scoured through the language for each state, right?
Correct.
And divided. That's how this whole map was created and color coded. And the takeaway that I'm hearing is that the states that are green really don't have stringent requirements to be able to work with a patient or a client in those states.
Correct. Now, I did mention reimbursement briefly. So in the green states, most third-party payers will not reimburse unless you're licensed.
Okay. You mean for like third part, are we talking governmental, like Medicaid, Medicare, or are we talking insurance, private insurance?
Private insurance.
Okay. Okay. Yeah.
That may apply to Medicare, Medicaid too. But so even if you live in a green state like Texas, the insurance company is going to require you to be licensed in order to be reimbursed.
Okay.
It's not going to be a state requirement.
Gotcha. So you could be a cash-based practice.
Yep.
Okay. Very cool. Okay. So, all right. So one of the questions that we got is, I don't know if you can comment on this, but what about out of the country? I do get this question quite a bit too. I mean, where do you even go with that? I don't know. I'm going to put that one in your court. Honestly, I don't know where to go with that.
So I'm assuming the scenario involves an American RDN who seeks to practice, say, in Canada or Germany or UK or something. So in those cases, the law of the country where the client is located is going to govern.
Yes.
So it's generally speaking, it's up to that country if they want to automatically accept American licensure or to say require, additional prerequisites, additional qualifications. My understanding is the CDR does have agreements for other people living in other nations to practice here with, say, minimal paperwork, not zero paperwork, but minimal. So in other words, I believe one of the countries is the Philippines. A dietitian living in the Philippines can become registered here, and then of course proceed to licensure in an individual state. And I'm assuming that same principle applies in the other direction, from America to, say, the Philippines.
Uh-huh.
but it's going to be on an individual country basis.
Okay.
So the last time I looked at that webpage, the CDR had relationships with a limited number of nations. I believe it was about 5 or 6, I think. So ultimately, again, it's up to that nation. And of course, in most of those nations, they don't have individual states that license. You get a license for the entire nation. So it's up to that nation to accept or require additional.
Okay. Great. All right, guys.
Let me add one quick point,
Sure.
and I understand we may be running short on time here. Go to the website of the international affiliate, which is iaand.org.
iaand.org.
And there are country representatives for many, but not necessarily all nations globally. So you can contact an RDN in the Philippines or UK or Austria and talk to somebody who lives there, and they will tell you what the requirements are.
Okay. Oh, that's a great resource. Did I spell that right? iaand.org. Okay,
Yep.
cool. All right, that's a great resource. All right, guys, time to wrap her up. All right. So thank you so very much for all these great questions. And a big thank you to Mark for sharing this insight with us today. Honestly, I just so appreciate your time and your willingness to update us on, the state of the compact legislation, which is super exciting. And also just giving us the background on how we came up with this map, how you guys came up with it. It really helps. So thank you to everyone that joined us, and a big thank you to Mark as well. So really appreciate it. Such a great topic. Thanks to everyone, and I look forward to seeing you next time. Okay, bye everybody.